cause of vision loss in people over the age of 60, affecting over 10 million Americans. Because the disease often happens in older people, it is called age-related macular degeneration. To tell us more about this degenerative condition, we have with us today ophthalmologist Dr. Priya Kalyam. Dr. Priya Kalyam is a board-certified ophthalmologist and oculoplastic and facial cosmetic surgeon. She specializes in eyelid and orbital surgery. Dr. Kalyam was a Dean's Scholar student and earned her Doctor of Medicine at Robert Wood Johnson Medical School in New Jersey. She completed her residency in ophthalmology at Yale University School of Medicine and a 2-year fellowship with the American Society of Plastic and Reconstructive Surgery at the prestigious Washington University in St. Louis, Missouri. A quick note before we get started. We will have a brief Q&A after the presentation. So if you have any questions relating to today's topic, please do submit your questions in the chat window. With that, I am delighted to welcome Dr. Kalyam. Dr. Kalyam, thank you for joining us today. Over to you.
Thank you so much for having me here again today. It's a pleasure to talk to you about age-related eye diseases and conditions. I hope to shed some light and answer any questions that you may have at any point, and I'm sure they'll guide us on when to do that. So without any further ado, let's continue. So vision changes, we all know which ones they are and move forward. But before we continue and talk about diseases, I do want to emphasize to all my patients and definitely to the community that if you're age greater than 50, it's important to have a comprehensive dilated eye exam, especially with your eye care professional, and how frequently to get the exams. Once you get your initial exam, your eye doctors can tell you about it. The reason being, unlike your kidneys and your heart and your lungs, which are inside your body where you can't even see them, the eyes are sort of a window to the rest of our body. And I just want to take a brief moment to mention that just by looking at the eye, you can diagnose several conditions in the body, including diabetes, high blood pressure, many other diseases, including things like MS. You can name it. You can even diagnose rheumatological diseases. So without deviating further from the talk, I strongly encourage everyone here to have a comprehensive eye exam at least once at the age of 50 and go on from there based on your doctor's recommendation. So what is a comprehensive eye exam? It's not just the regular vision exam that you might get at a LensCrafters or Costco. A comprehensive eye exam is beyond vision. It's beyond your ability to see from glasses or contact lenses. You want somebody with a medical degree, like an ophthalmologist, to take a look at the health of the eye. And usually it's done by a dilated eye exam where drops are administered to the eye. So if you look at a normal eye, a pupil is the window to the eye, which allows and focuses the light. And looking at a cross section, that's this little tiny opening. When a light goes in, if you're doing an undilated eye exam, which is what most optometrists do, you're only able to a certain part of the eye. This whole thing in the back of the eye is the retina, which is responsible for vision. Just like an old-fashioned camera, you have a lens, and then you have a film in the back of the eye. And you want a dilated eye exam where the pupil is enlarged using different medications, and you're able to get a full view of the back of the eye in order to be able to diagnose a lot of these age-related diseases. Okay, having spoken about how it's diagnosed, what are some of the age-related conditions that we notice. Obviously, the talk today is about age-related macular degeneration, and the most leading cause of vision loss all across the globe is cataract, diabetic eye disease, glaucoma. I've spoken previously to a whole bunch of you about dry eyes and low vision. Certainly, we can cover all these topics at a later date, but let's continue to talk about age-related macular degeneration, which is very highly prevalent and common in United States. So what is this age-related macular degeneration, right? As the name suggests, as we age, usually over the age of 60, you can have macula. Macula is the central portion of the vision that's responsible for the majority of our life, what we see in the center of our vision. And when that macula, part of the film in the back of the eye, starts to degenerate, why does it degenerate? Just from normal aging, just like you get wrinkles, just like your teeth start to decay, just from age-related changes, you can get damage to the macula, which is responsible for the central portion of the vision. Again, who is at risk? As the disease is named, age. Age is the biggest risk factor for developing this unfortunate disease. And certainly other factors such as smoking, especially smoking for more than 10 years, has a strong risk factor for macular degeneration because, as we know, smoking has free radicals and causes a lot of oxidative stress, which causes degeneration of sensitive neurosensory cells. Okay? And certainly family history is a risk factor. If your grandparents, if your fathers or your siblings have macular degeneration, then you're more likely to develop it in yourself. And certainly obesity has been linked to it as well, just like hypertension, etc. And unlike South Asians, Caucasians are more likely to lose vision from macular degeneration than South Asian population. It is believed that the pigment in our skin may be protective, but then again, not enough research has been done. At least in the United States, Caucasians are more likely to develop macular degeneration than other counterparts who have more pigmentation in their skin. Okay, what is macular degeneration? A lot of people have asked me already. So if you were to look at a clear picture, if you were to have a cataract, everything is blurry. But with macular degeneration, the peripheral vision is relatively clear, but unfortunately your central vision goes away. When I see patients with macular degeneration, they often complain that they no longer can recognize faces because when they look centrally, they cannot see it. They have to move to the side so they can see the corners and try and identify somebody. Okay, so you get central smack in the middle, you get vision loss and things start to blur up because that's what the macula is responsible for. Okay, what are the symptoms? How do you know you have macular degeneration? It's very painless. You'll never know this is happening because it's slow and progressive, just like you get wrinkles, right? When you compare a photo of yourself when you were 20 and you compare your photo of yourself when you're 80, you see a lot of changes. But how did you get to that? It's very gradual. It takes decades, years, months. And then suddenly you realize, oh my gosh, I really can't see that in the middle anymore. So it's slow, it's progressive, there is no pain associated with it, and you get blurred vision right in the center, okay? And your eye doctor may talk about something called drusen, which is a hallmark finding in macular degeneration. And we'll talk about what is drusen and what are some of the terminologies that your eye doctor may use during your eye exam so that you can help navigate and ask the right questions that pertain to your condition. Okay, to understand a little bit, let's learn about pathology without going into too much of science. I just want to show you some pictures and teach you some anatomy. So this is normal, healthy eye. When you look into that back of the eye, that cross section that I showed you, this is our optic nerve, and this is the whole retina, and all the nerve fibers go into the nerve, and from the nerve, it goes back into the brain. And then you have blood vessels that feed the retina, okay? But this central portion right here is responsible for majority of our visual field, which is about less than a millimeter in size, okay? And there's two different types of macular degeneration. One is called the wet macular degeneration. The other one is a dry macular degeneration. Usually, most patients start out as a dry form of macular degeneration where the cells in this macula start to break down and they start accumulating dead cells, protein, calcium, and they look like this. This is exactly what you see when you look in the back of the eye during a dilated eye exam. What are these things that I am showing you? These are what are called drusen. They look like yellow deposits. And because these deposits are all over there, they start damaging the retina, and that areas of the retina start to die. Okay, this is the dry form. What is the wet form? When these drusens start to become worse and all these blood vessels become inflamed, they start leaking fluid and sometimes they can bleed, making this disease far worse and making the vision loss more significant. Okay, again, let's look at the cross section again. This is the retina itself. Looking at a layer of the retina in cross section when you do an ultrasound imaging, it almost looks like a cake with multiple layers with frosting in between. A normal healthy retina is supposed to be like this. Nice little frosting. There's different names for it without getting too deep. The center of the vision is supposed to be nice and come down like a cone like this with layers without any fluid in between. It's nice and sharp. When you start developing these drusen, this is what your doctor will show you in an exam room. Hey, you're developing drusen. And that's what it looks like. All the dead cells and junk accumulating right underneath the nice cakey layer. Okay? When the dry form becomes wet, you start leaking fluid. And you see the fluid accumulating underneath it. And you no longer have that nice, sharp shape. And the fluid can get worse and worse as time goes. And when the layers are spread apart, this layer is no longer communicating with that layer, and you get death of cells and loss of vision that can be permanent. Okay? Again, the part of the visual field that is mainly affected during macular degeneration is the central part of vision, which is the macula, which is responsible for the details of our vision, the colored vision, and the bright light. Okay? So how can you test yourself without going to a doctor, or even if you go to a doctor, in between visits, how do you know if you're developing symptoms? It's good for you to print out something like this called an Amsler Grid. You can Google it, you'll find it. With this, the way you test yourself is to close one of your eyes and look straight ahead in the center. And when you look straight in the center, the rest of the lines should look like perfect squares. But when you look in the center, they start looking squiggly and wiggly. Then you should be suspicious that something is going on in your macula and you should go get an eye exam done. Okay? And this is very good to test yourself. Just throw one of these on your refrigerator and it's a good 2-second test to see if you're able to see everything clearly or not. Okay? So unfortunately, what are the treatments for macular degeneration? There is no outright cure for age-related macular degeneration. It's really sad, but we don't. But nutritional intervention has shown that you can prevent the dry form where it's not leaking to prevent progression into a wet form. So what kind of vitamins are needed? These are high doses of antioxidants like beta carotene, all the other kinds with zinc, vitamin C, and they're usually called the AREDS vitamins. I'm sure Preservision, even Costco sells them. Those are really good vitamins, all antioxidants, because we know this is oxidative damage to the cells that causes atrophy. By taking some antioxidant and multivitamin and healthy nutrition, you can prevent it from progressing, but unfortunately you cannot change your genetics, okay? It's just like our wrinkles, we can apply sunscreen, lotions, and potions to make it moisturized and soft and look beautiful, but you cannot prevent aging, right? It's the same thing with macular degeneration. In 2021, we cannot prevent it, okay? But let's say, okay, I've got wet AMD now, or wet macular degeneration now. What can I do from these abnormal blood vessels from leaking that fluid and splitting up the layers of my cake? Your layers of cake are getting split because there's fluid leaking in between. So what can you do then? Certainly, I'm sure a lot of you who suffer from macular degeneration get monthly injections of these FDA-approved drugs called Avastin or Lucentis or Eylea. These are actually chemotherapeutic drugs, and people found that when people were undergoing chemotherapy with these medications, that their vision improved suddenly. And that's when they realized we can inject these drugs directly into the eye, and they can help control the blood vessels from becoming abnormal and prevent leaking. But they're not going to change what you already have. It only prevents it from getting worse. A lot of the patients, when I used to treat macular degeneration, used to come and say, oh my God, I've had 10 injections already. How come nothing's improving? And it's unfortunate, but we cannot improve what's lost. So that's why do not stay at home for a longer period of time saying, oh, I have no treatment. But if you come in early and get these injections, you can prevent a progression. So you can save what you have as long as you can save it, okay? There's certainly surgeries that can be performed if the bleeding is excessive. And sometimes laser therapy can be used to heat the back of the retina to prevent the bleeding vessels from bleeding, okay? So very important for all the macular degeneration patients, I hope that all your eye doctors are pushing you for it, is to become familiar with different modalities to help continue your daily life, right? COVID is here, but our daily life needs to move on. Same thing with macular degeneration. Just because you have it, we don't want you to stop your life and keep thinking about the vision. Instead, you can continue enjoy reading by using large print devices. There's magnifiers and telescopes that a low vision doctor can help provide you so that you can continue to enjoy your movies or continue to see old photographs of yourself. And certainly computers can help in maximizing your vision. And certainly adjusting the lights and organization techniques and mobility training can all help you navigate around your home. Okay, hope that sheds some light in macular degeneration, although we know there is no treatment. Any other questions that you have, I'm happy to answer. I cannot hear you. Hello? I cannot hear you.
Oh, sorry. Are you able to hear me now?
I can hear you.
Okay, sorry about that. Thank you, Dr. Kalyam, for an insightful presentation. We will now dive into Q&A. For those of us who might have joined late, if you have any questions relating to today's topic, please do submit your questions in the chat window. Dr. Kalyam, when it comes to diseases of the eye, we often hear about cataract and glaucoma. How common is macular degeneration among South Asians?
That's a great question. In fact, I realized that I was going to present to you guys, and I actually looked up the data on that. To be honest, the research is not there. At least in India, they said that there's about 77 million people in India. Depending on different parts of India, the prevalence can be anywhere between 0.3% to 40%. Yes, that doesn't make sense, right? But this is over the age of 60. I'm sure if you're in a bigger city where a lot more people are going to the doctor, to actually an ophthalmologist who's able to look with dilation to look in the back of the eye, I'm sure they're probably able to discover a higher percentage. But certainly if you're in the villages where you have no access to a regular eye doctor, the prevalence is a lot lower. So the data is very skewed. But in general, at least in United States, having done my training here, I must have seen a very only a handful of South Asians or even pigmented population in general leaving South Asia, even African Americans or even Hispanic, very low numbers compared to the Caucasian, white-eyed, blue-eyed, light-eyed population is much higher compared to South Asians. But then again, there aren't that many South Asian population who are over the age of 70 in the United States compared to back home in India.
Okay. What are the recommended supplements for people suffering from this disease?
Sure. The most often recommended supplements are the AREDS vitamins. The AREDS are, preservation is one of them. They're all available. They're mainly antioxidants like beta carotene. There's very special formulations. I can list it or actually type it out for you. It's mainly 500 milligrams of vitamin C, 400 units of vitamin E, 15 milligrams of beta carotene, and some zinc oxide, which is 80 milligrams, and 2 milligrams of copper, all mixed together. That's what AREDS are. And large studies have been done which show that taking AREDS vitamins helps in preventing progression from that dry form to that wet form. And it's also been protective, let's say, of macular degeneration in one eye. It'll help protect the good eye too.
Okay, so when someone has this disease, how fast does it progress?
So it all depends. People can have a small drusen, and we've observed them for 20, 30 years with very minimal change. But you don't know when the dry form can convert to the wet form and cause significant vision loss. And even with the dry form, they can be fine, and suddenly you see atrophy of the retina, even without leakage of fluid, and that's permanent. And so it all depends. But in general, it's not like you're diagnosed with macular degeneration today and you'll go blind tomorrow. It's usually slow, progressive change.
So correct me if I'm wrong here. So it's you first get the dry form and then it progresses to the wet form?
That's right. But even the dry form by itself can also cause the death of the cells without any leakage of the fluid.
Okay, so is this condition genetic? And if it is, what can someone do to lower their risk of getting this disease?
So yes, it can be genetic in the sense that if you have a family history of it, then you can get it. Certainly, there's different kinds of diseases in the body where if you are somebody prone to sun damage, then you can get more of it. Avoiding sun can help. But certainly you cannot change your genetics. Again, this is not a type of disease where you get when you're born. This is a disease that you get when you're much, much, much older, like in your 70s and your 80s. There isn't much you can do to change your genetics. You've lived 80 years of your life already in a healthy way, but you can take caution and take vitamins, avoid smoking, maintain a healthy diet, avoid obesity. All those things which can add to the oxidative stress can help you.
Okay, moving on to the next question. What vision aids and resources are available to those who are suffering with advanced macular degeneration?
Excellent question. This is something I love. I used to work at the VA where a lot of our veterans used to have this. Unfortunately, for civilian patients who are living outside, some of these devices are very expensive and pricey. But certainly if your insurance provides it, you should look into telescopes. They're little tiny things, like just like a glass. You'll get a little telescope that can be hooked to your eyelid just right over here where things are zoomed. So they're much zoomed that you can look into the back of the eye. They even have televisions that are made for macular degeneration patients. You can program it in such a way that everything is magnified, meaning you can have a larger TV in the house and magnify everything. Because remember, the central portion of the vision is blurry. Let's say like my face portion is blurry, but this part is all nice and clear. So you want to maximize it. If it's a letter A that's over here, you can't see, but if it's a letter A that's big like this, you can recognize it better. So you want to magnify things. So there's lots of magnifiers that you can use to make the image so large that it'll fall on the healthy portion of the retina so you can recognize it.
Okay, our next question. This viewer is saying that he has heard that looking at the sunrise or sunset directly may cause harm to the macula, and he wants to know if this is correct.
Absolutely, 100% right. It's called solar retinopathy. That is different from macular degeneration. But yes, the sun damage from staring at the sun also causes vision loss in the center, similar to macular degeneration. That's why you do not want to stare at the sun. And God has made us in such a way that when you see bright sun, it makes us automatically close. So there's a reason for that. If not, we'd all be blind. But it has been observed in especially alcoholic patients who fall down, when they're super drunk with their eyes open and the sun is directly going into their eye and the eyelids are not closed, they wake up blind centrally because the sun damage is very powerful. It can degenerate the retina directly. Remember, what we talk about retina is nothing but the brain tissue. It's directly nervous tissue. So it's very, very sensitive to light, to temperature, because with direct sunlight, the temperature goes up too. So it can be very damaging.
Okay, that's a good point to remember. Moving on, should someone suffering from AMD be driving?
So again, it depends. So legally in the United States, if your vision, combined vision in both eyes is less than 20/40 or less, 2200 or less, you're legally blind at 2200. So again, you have to use caution. If a child is crossing the road, if you feel like you're not going to be able to stop in time, if the child is crossing the road and a certain portion of your visual field is not visible, you should not drive. So you should definitely drive only in well-lit conditions, and certainly if your vision is very poor, like 2200 or worse, I would not advise driving at all. And certainly you can ask your medical doctor when they see you based on a visual field testing. They'll tell you what's comfortable. I would never tell anybody, don't do anything that you're comfortable with, and do not always be cautious when you have vision-related issues.
Okay, we are moving to our last question now. Are there any foods that can be avoided for someone suffering from this?
Avoided, I'm not sure, but certainly you probably want to avoid any, obviously you want to eat healthy, nutritious food. Unfortunately, in America, we eat a lot of processed food. So I would probably say avoiding processed food is a good idea. Definitely no to smoking. Smoking is very bad in any form for all kinds of diseases that are age-related. But definitely fresh fruits and vegetables will beat anything else out there. I'm a bad eater myself, so I know. But any particular food to avoid, I would say avoid processed food.
Okay, thank you, Dr. Kalyam. That brings us to the end of our question and answer session today. That was very informative. Thank you again for taking time out of your busy schedule. Now over to Pooja ji for announcements. Pooja ji, can you hear me?
Hello.
Okay. Yes, I was just trying to unmute. Thank you, Ragini ji, and thank you so much, Dr. Priya Kalyam. It was an amazing, sweet, to the point session. Thank you so much for joining us today. And I know you had to run to a different emergency, but you did make time for us and come over here. Really appreciate that. And you have come to the Radha Krishna temple to give health seminars more than once. So really so much appreciate that and sharing all your knowledge and helping all of us here. And we are so glad you have an office right here in Allen, close to the temple. So that's really nice. Now going over to some of the announcements that we have at the temple. The Radha Krishna temple has been as active as ever, even during these times. All our programs have been being broadcasted online. I would like to get the viewers' attention to some of the very useful programs that are being conducted throughout the week, and these are being conducted by very well experienced and knowledgeable volunteers and instructors. First of all, the Prem Yoga community was just launched about a week ago, where, like you see, it's during the whole week, a bunch of sessions of yoga, meditation, subtle body relaxation, and particularly office yoga, that is, the chair yoga, that is very beneficial for people who have sedentary lifestyle, are being conducted throughout the week. So you can go on to jkyog.org, PYC, for getting the information. There's also a WhatsApp group if you'd like to join there. Currently, we are offering an open house for this program where the entire all the sessions are free up till the Feb 12th. So encourage all of you to check those out, and if you have any questions, do reach out to one of us, and we'll be happy to answer any of those questions. I would also want to bring attention to our JKYog Daily Wisdom from Bhagavad Gita. That's every Monday to Friday, every day from 9 to 10 o'clock in the night. It is, I would say it has nuggets from Bhagavad Gita. The shlokas being discussed very, very interactively. Like nice games for us to contemplate and remember as well. So encourage all our viewers to check those things out. And like you see on the screen, there are like a whole bunch of different classes going on, like the Carnatic music, the Tulsi Ramayan, and starting February 1st, that's Monday, we are going to have Morning Gems by Swami Mukundananda ji. It is going to be, I am very excited about that particular session. We are going to start off the day with 30 minutes of power-packed inspiration. It will consist of yoga and a very nice inspirational message and some, things to do throughout the day to get us started, to propel ourselves forward in our doing our best in whatever we do. So encourage all of you to join all these sessions. And with that, I think we'll conclude today's program a little early today, but do join us for the daily Bhagavad Gita right after this at 9 o'clock. With that, thank you both Ragini ji and Dr. Priya, and we'll look forward to having you back again.
Absolutely, anytime. We still have more topics to cover.
Yes, absolutely. Thank you.